Hello, listeners, and welcome back to Everyday Health Stories, the podcast where we explore the fascinating world of medical science through the power of storytelling. Today, we're diving deep into a heart condition you might not have heard of, calcific aortic stenosis. It's a mouthful, right? But don't worry. Dr. Reddy's here to break it all down for us.
Thanks, Anna. Glad to be here.
So, what exactly is calcific aortic stenosis?
Well, Anna, calcific aortic stenosis, or AS for short, is a progressive narrowing of the aortic valve. This valve is crucial, you see. It controls blood flow from the heart to the rest of the body. Over time, calcium deposits and scar tissue build up, making the valve stiff and harder to open. This restricts blood flow, forcing the heart to work much harder.
Oh, wow. So, how common is this, this AS? Is it like a rare thing?
Not as rare as you might think. It affects about 1 to 2% of adults over 65, and that number jumps to a concerning 12% for those over 75. Globally, it leads to over 100,000 deaths annually. It's definitely a condition we need to be aware of.
100,000? Wow, that's really serious. So, what happens if it's, left untreated?
If severe AS is left untreated, it can be life-threatening. Studies have shown a mortality rate of up to 50% within just 1 year of symptom onset. That's why early detection and treatment are so vital. We'll talk about treatment options a bit later.
Okay. So, what causes this, buildup? And who's most at risk?
Good questions, Anna. Most often, it's either a congenital bicuspid valve, meaning you're born with a valve that has 2 leaflets instead of the usual 3, or it's the degenerative calcification of a normal tri-leaflet valve. Think of it like rust forming on a gate hinge, eventually making it difficult to open. Less common causes include rheumatic fever, certain metabolic conditions, and sometimes even iatrogenic factors. Basically complications from medical procedures.
Oh, so it can happen, even if you're totally healthy otherwise?
Exactly. But there are certainly risk factors that increase the likelihood. Age is a big one, as is being male. High blood pressure, smoking, diabetes, chronic kidney disease, coronary heart disease, and high lipoprotein A also elevate the risk. Even, things like poor dental hygiene can make you more susceptible to infections that can damage the heart valves. And lifestyle factors like smoking absolutely contribute as well.
Wow. So many different factors. So, how does this, calcification, actually progress? Does it just happen overnight?
No. It's a gradual process. It starts with lipid infiltration and inflammation of the valve leaflets. Over time, this leads to fibrosis, calcification, and stiffening of the leaflets. It's actually quite similar to the process of atherosclerosis, the hardening of the arteries. As the valve narrows, the heart has to work harder, which can lead to left ventricular hypertrophy, diastolic dysfunction, and ultimately, heart failure.
Right. So, there are different stages to this AS thing?
Yes, there are 4 main stages, from stage A, where there's risk but normal valve function, to stage D, where severe symptoms emerge. The progression through these stages is generally tracked by measuring the velocity of blood flow through the valve. The faster the blood flows, the more narrowed the valve is. Okay.
So, how do you even know if you have this, aortic stenosis? What are the symptoms and how is it diagnosed?
Well, Anna, the tricky thing about AS is that symptoms often appear late in the disease's progression. Early on, you might experience reduced exercise tolerance, exertional dyspnea, that's shortness of breath during physical activity, and dizziness. As it progresses, more serious symptoms can develop, such as angina, heart failure, and even syncope, which is fainting.
Oh, wow. So, by the time you have those symptoms, it's already pretty serious?
Yes. Unfortunately, that's often the case. That's why early diagnosis is so important. The gold standard for diagnosing AS is echocardiography. It's an ultrasound of the heart that allows us to visualize the valve, measure its opening, and assess the blood flow. We can also use computed tomography or CT scans to get a more detailed look at the calcification and plan any necessary interventions.
Right. So, what about blood tests? Can they, detect AS?
While there isn't a specific blood test for AS itself, we can use biomarkers like B-type natriuretic peptide, or BNP, to assess the heart's overall function. Elevated BNP levels often indicate cardiac decompensation, a sign that the heart is struggling to keep up with the demands placed on it. In some cases, we may also use stress testing to evaluate functional capacity and provoke symptoms, especially in individuals who are asymptomatic but suspected of having severe AS. This helps us understand the extent of the valve narrowing's impact on their ability to exercise safely.
Okay. So, if you're diagnosed with aortic stenosis, what are the treatment options? What can be done about it?
Well, for symptomatic severe aortic stenosis, intervention is absolutely necessary due to the high mortality risk, which can be up to 50% at 1 year if left untreated. The two primary treatment options are surgical aortic valve replacement and transcatheter aortic valve implantation.
Wow, 50%. Okay, so what's the difference between those two procedures? Surgical aortic valve replacement versus transcatheter aortic valve implantation?
Surgical aortic valve replacement is the traditional open heart surgery. It involves replacing the diseased valve with either a mechanical or biological valve. It has a proven long-term durability, particularly for bioprosthetic valves, which last for 20 years or more, and it's generally preferred for younger patients, those under 65, or those who are already undergoing other cardiac surgeries. Transcatheter aortic valve implantation, on the other hand, is a minimally invasive procedure where a new valve is inserted through a catheter, usually in the femoral artery in the groin, and then guided to the heart.
So, one is open heart surgery and the other is, done through a catheter. That's a pretty big difference.
Absolutely. Aortic valve implantation is associated with shorter hospital stays and quicker recovery times. It's usually the preferred option for patients 80 or older, or for those considered high risk for traditional open heart surgery. But aortic valve implantation does have some drawbacks. There is a greater risk for paravalvular regurgitation, where blood leaks around the implanted valve. It also carries a higher incidence of requiring a pacemaker. Also, its long-term durability, while comparable to surgical aortic valve replacement in older patients up to about 10 years, isn't as well studied in younger populations. So, we still need more data there. Choosing between valve replacement and valve implantation is a decision best made after a thorough discussion with your healthcare team, taking into account individual risk factors, age, and personal preferences. It's really crucial to be fully informed.
So, what about managing aortic stenosis if you don't have symptoms yet? And what's the long-term outlook? The prognosis?
Managing asymptomatic aortic stenosis primarily involves careful monitoring and lifestyle changes. Regular echocardiograms are key, typically every 3 to 5 years for mild AS, 1 to 2 years for moderate, and every 6 to 12 months for severe AS, even if there are no symptoms.
Wow, that's a lot of monitoring.
It is, but it's essential to track the progression of the disease. Managing risk factors is also crucial. This includes controlling hypertension, treating high cholesterol, quitting smoking, and, surprisingly, maintaining good dental hygiene to prevent endocarditis.
Really? Dental hygiene?
Yes, absolutely. Bacteria from the mouth can enter the bloodstream and potentially infect the heart valves, especially damaged ones. With valve replacement, whether it's surgical aortic valve replacement or transcatheter aortic valve implantation, the survival rates improve significantly. They return to normal levels, similar to people of the same age who don't have aortic stenosis. It's truly remarkable.
Oh, that's good to know. So, you're saying that after treatment, people can pretty much live a normal life?
In most cases, yes. However, some patients might continue to experience symptoms even after valve replacement, often due to residual dysfunction of the left ventricle or a mismatch between the implanted valve and the patient's individual anatomy. And, well, there are still some unanswered questions in managing AS. We lack really effective drug therapies to slow the disease's progression. There are some ongoing studies looking at the role of statins, bisphosphonates, and calcification inhibitors, but nothing is conclusive yet. More long-term data is needed on transcatheter aortic valve implantation outcomes, particularly in younger patients.
Dr. Reddy, this has been incredibly informative. Thanks for shedding light on such an important topic. I really learned a lot today, and I hope our listeners did too.
My pleasure, Anna. I'm always happy to share insights on such important health topics.
Before we go, I just want to remind our amazing listeners that this is all for informational purposes only. Make sure to check with your doctor about any health concerns.
And if you're enjoying our conversations here on Everyday Health Stories, take a moment to hit that subscribe button. You'll get notified about new episodes and join our wonderful community of health enthusiasts.
Very well said, Dr. Reddy. See you next time, everyone. Keep staying curious about your health and keep listening to our podcast. Remember, every story has the power to transform lives.
Take care, everyone, and we'll catch you in the next episode.